Welcome to Midwifery Skills or Midwifery Practice. It's very, very important in our profession because one has to be knowledgeable, skillful, and then attitudinal change so that we can offer the right service to clients who come to us. And this practice may include preconception, conception, birthing, immediate and subsequent care given to the newborn, family planning services, and all other services that the midwife would give. It's very, very important in the profession. And because of that, the mother and the baby, sometimes twins, triplets, quintuplets, they are all in the care of the midwife. That means that their lives depends on us, and it's dependent on our knowledge, the theories, the skills that we apply, and then the attitude that reflects our knowledge and the skills. So once we are entering into this area, it's very, very important to take note that our knowledge should be applied. The skill that we issue in this attitude also will reflect the skills that we have so that we can give the right treatment or care to our clients. This morning, I'm talking about general examination of the pregnant woman who has come to us. This woman has come, so we are going to examine the woman from head to toe. So with the head, you pat the hair to at least find out how the woman is taking proper care of her hair. Talk to her, and then you come to the face, you examine the eyes, the conjunctiva for anemia, for discharges, or any such things. You look at the nostrils, whether she has any blockage in the nose. And then the mouth. With the mouth, you can be talking to the woman. While she is talking, she will laugh. You see her. Occasionally, you can even ask her to pull out her tongue to see how the tongue is. Okay. Then from there, you make sure that the ears are also examined for any discharges or any pain. You can talk to the woman, ask her, include her in the care. And then you come to the neck, you palpate for any swelling, any pain that she may complain of, or if she doesn't have any pain, you come to the chest, then you examine the breast of the woman. And with the breast, when you reach there, you open the breast, the two breasts, and then you observe any rashes, swellings, the shape of the breast before you even examine the breast. You cover one side and then you palpate from the armpit. But before then, always do your best to clean the armpit, because the woman, as he has been walking to your side, you're going to use your bare hands to do that after you've washed your hands. So you do not want to touch the woman's sweat. Try to clean the armpit with cotton. And before, inform her that you want to clean the armpit a little before you even palpate, so that you touch the axillary spines, tail of spines, to touch any swelling from that side before you come to the breast. You palpate in circular motion all around to the areola and the nipple before you squeeze. And then when you hold the breast, it's like you push to the chest, and then you compress, then you release. So push to the chest, compress on the areola area, and then you release for the breast milk to flow. You apply the same procedure to the other breast. And when you finish, you come to the arms of the woman. So, before, when you are palpating, you raise the hand at the head side so that you can see the breast very, very well. You hold onto the hands for equality, and then you look at the nail beds, also checking for edema, and then the HB level. You can also see it from that area. And from there, you come to the abdomen. Palpate from the funda area to the lateral left and right. Whilst you support one side, then you palpate, not with the fingers, but with the parts of the hand. Okay. So you palpate from up down. Please, when you are palpating, don't be moving up and down, up and down. So you don't have to rush. You take your time so that you note what is at the right side. You are looking, the attitude of this child, baby, is that of flexion. If it's cephalic, it's longitudinal, and the attitude is flexion. And so you would be palpating to locate the back where you find a place to be smooth so that you can listen to the fetal heartbeat. The roughing area contains the limbs of the fetus. Okay. And when you finish and you come down, you ask the woman to flex the knees and then breathe through the mouth. Then you palpate to locate what is occupying the lower pool. More importantly, it may be the head, if it is cephalic presentation. In breech, you identify the buttocks, which is very soft. And at the funda area, it will be the head, which will give you a hard mass up at the upper pool. Then, when you are able to locate that, you ask the woman to straighten the legs, and then you try to find the anterior shoulder of the baby. Now, this anterior shoulder, you palpate, is close to the midline. Don't go too far away and not in the midline. It's very close to the midline. So you use your two hands to palpate to locate the anterior shoulder. When you are able to locate the anterior shoulder, you place one finger over there. Then the lower border of your ulna go on the upper border of the symphysis pubis. Then you stretch. The number of fingers that will reach where the anterior shoulder is will give you the descent of the baby's head. How far the head has entered into the pelvic brim. Okay. If it is sitting at the pelvic brim, it will give you 5.5. If one finger reaches up there, then the descent will be 4/5. So it follows that suit. Okay. So from there, you come to the lower extremities of the woman. So you palpate down, touch the thighs, the limbs, and then the calf muscles. Okay. Then you ask if she has any problem, pains, which may be an indication of DVT, deep vein thrombosis. Then you press with the thumb at the medial aspect of the ankle to look out for any edema. So when you press, if there is edema, it will dip and it will take some time before it fills up. If there is no edema, it will not pit. So that is the lower extremities. Then you bring the legs together to also find out if there is any shortness of the limbs. That will also give you a clue of how the labor may go. When you are done, then she will pat her legs for you to examine the vulva. Please, you are not going to use your fingers over there. Just observe if she has any discharges, any sores over there, which is an indication of syphilis, any offensive odor, which is an indication of infection over there, and sometimes any if she has any STDs, which may show up with that offensive odor coming out from that place. Any swelling, any varicose veins. So you look out for all these things at the vulva area. You don't touch there. Yours is to just observe and then When you finish everything, she may go to see the doctor. And then when you are done with everything, she will turn her back, and then you will palpate the back to look out for any deformity in the spine, any abnormality of that, any complaints, and then you will also examine the lumbar region for edema. That may be very, very occlusive. It may not be very visible, but when you press, you will see. In the other way, you can perform everything, including the back, and then the vulvar area will be the last area that you will check. Because when you finish up everything like this, then you will tell the woman all your findings, anything that you saw, and then in that process, we'll also talk about how she will examine her own breast after she has delivered. And when she delivers the first, when she resumes menses, some will resume 6 weeks after delivery, 2 months after delivery, 6 months, depending on, so that she can do the examination of the breast. If she finds any abnormality, she should rush to the hospital so that we take care of her complaints. If after this you have any questions, you can ask.